Let's talk about it. What is a root canal? So what is a root canal? A root canal is something when you... No, what is a root canal? Hey guys, it's Dr. Nate here, and I want to talk to you about something hopefully you don't have to go through, but if you're watching this video, probably in the process of it, had it, about to get it, and that is root canals, the dreaded root canal. So I'm going to talk to you all about it, why you need it, how you can potentially prevent it, what's going to happen if you get it, and everything that happens afterwards. Let's go. Let's dive into root canals. Let's go! All right, guys, it is the dreaded root canal. And why is it dreaded? It shouldn't be that dreaded. It should not be that painful. Sometimes it is, but hopefully it's not that painful. All right, on our teeth, we have 3 layers. We have an outer layer of enamel, an inner layer just below that of dentin, and just below that, we have something called the root canal. And that is where these nerves and blood vessels and cells and all this stuff are in there that keep that tooth vital. So if you've had a deep cavity, a fracture, anything along those lines, what the dentist does is they go into that root canal and clean it all out. They're taking out the nerves, they're taking out the blood vessels, they're taking out the cells to make that tooth healthy again. On top of that, once you get that all done, the majority of time, if it's in the back, if it's kind of anything behind your canine tooth, that sharp tooth right there, you are going to get a crown on that tooth, right? That's a very, very generic version of a root canal. Why do you need a root canal? So let's talk about why you may need a root canal. How do you know if you need a root canal? There's a ton of different reasons. The biggest reason probably is you have a large cavity. And if you have an itty bitty cavity, you know what it turns into? If you don't get that filled, it turns into a huge cavity. And that huge cavity most likely will need a root canal. That is one reason. The other reason is you can fracture it, you can smash it. You're playing basketball, you hit the ground, you smashed your front tooth, and now that tooth is what we call dead, or the blood vessels and nerves are kind of dead. You need to get a root canal. If that tooth starts changing colors, you may need a root canal. Potentially, if that tooth looks, really, really yellow or really, really gray or dark, it's because all the blood is kind of servicing towards the tooth, and it makes it give that shine. And you might need a root canal. You might need to bleach that inner portion of that tooth. You also may have like a fistula or like a little pimple looking thing. I've seen this actually just very recently. If you pull the person's cheek back, you'll see this little bump on the tooth, and you can kind of squeeze it, and there's all this pus kind of coming out.
Ew, gross.
And what that is all the infection trying to get out. And you might feel better. You say, oh, cool, everything's good. It came out, I feel better. But that doesn't mean the infection has gone away. It's still there. So if you feel that, you see that bump in that tooth, pretty much for sure you're gonna need a root canal. Probably one of the other reasons is you might just notice you have giant tooth pain. If you're drinking, it's really, really sore, really, really hurts. It's so bad that may be an indication you need a root canal as well. But you're saying, Dr. Nate, the dentist told me I need a root canal, but I actually don't have any pain. That no pain does not mean you do not need a root canal. So what happens is, just like I gave in that previous example, the infection can get so deep, it actually starts killing the nerves, and maybe you got pus coming out the side of your mouth, and actually doesn't feel so bad because the nerves and blood vessels are dead. But that means there's still this giant infection. It's like if you had an infection on your arm, would you just go, oh, cool, like I can't really feel it, I'm good? No, you would not do that. You would fill that infection. You would make sure it's all nice and clean, and it's the exact same thing inside your mouth. If you have a big infection, it may not necessarily hurt. It probably hurt at one point, but it may not necessarily hurt right now. But you still need a root canal just because there's no pain. If your dentist says it's a huge filling or a huge infection, you likely need a root canal. So what can you expect? Oh my gosh, the dentist told you need a root canal. I told you need a root canal. You need a root canal. What can you expect on some of the visits? So you'll come in. Initially, you're gonna get your x-rays, you're gonna get all these little pictures, and they're gonna show you exactly what's happening. They're gonna show you, hey, you have this tooth, boom, big filling, or boom, it's fractured, you need a root canal, so you'll be properly informed. That is step number 1. Then either at that same visit or another visit, they're gonna numb you up really good. Really good. If you're too infected, if the infection's huge, you may just get some antibiotics, and that's it for the day. And what you should be thinking, or you should be thanking your dentist for not doing anything that specific minute, because you get a ton of patients that come in, huge infection, and they want that tooth out, they want that root canal done that second. Why is that not good? Because if the infection's huge, you can actually not really numb that area. If you think root canals are bad, or if you think extractions are bad, imagine how tough they would be if you can't actually get numb. So what happens is you give the injection, but because it's so acidic in that area, it just dilutes the actual lidocaine or whatever you're using in that area, so your area does not get numb. So what we do is we give you antibiotics so you feel nice and good, so the infection kind of goes down a bit. It's not totally taken care of, but the infection goes down. And so when you come back in a week or so or a few days, they can give you an injection and you can be nice and numb. So after you're nice and numb, you might get some
laughing gas, maybe something to make you feel a little bit better.
And they are going to start the procedure. Normally what they're going to do is they're going to remove all the infection initially. They want to make sure they can restore that tooth. If that infection is too big, they're going to take away the decay. They're going to remove all the decay. It shouldn't be painful, but they're going to remove all the decay. If it's so bad, they're going to tell you at that point, hey, we can't restore the tooth. The infection is too big. That is what happens in an ideal situation. So they're going to take it, they're going to remove all the decay, and then they're going to go in there with these different tools and they're going to remove the pulp. They're going to remove all these nerves, they're going to remove everything and clean it very, 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 very well. You want to make sure you get out all that infection, because if you leave infection behind when you put on the crown or do all these other things, the infection is just going to stay there, and then you're going to need another root canal, or maybe you need to take out the tooth. So they take their time with this. This may be done in one visit, it may be done in 2 visits, depending on how bad your infection is and how tough the tooth is to work with. If it's a back tooth way in the back, they may do 2 visits. Sometimes they do 1. It's just all going to depend. You should probably ask your dentist what they're going to do for you. After they remove all the decay, the gross tissue, they're going to fill it up with something called gutta percha and all these other natural elements to make you feel better and to give that tooth at least a little bit of strength. I know root canals get this bad rap that they're so bad, but they are very inert. It's all these inert substances that you're putting in your mouth, and it's very, very safe, and they've been used for a very long time. So after they do that, they're going to fill out these root canals, because you do not want an empty tooth. You don't want to just take out all this stuff and then have nothing to replace it, because you're just going to have like a hollow little tooth, and then that tooth's going to smash and break and it's going to be worthless. So what they do is they fill it with something so it's actually filled, and then they're going to prepare the tooth again for crown. You're going to get an impression, and the impression then gets sent off to the lab, and you will leave that day with a temporary crown. And that is kind of like a pretty strong plastic type of material crown that you will leave with as you go home. You got to be careful. You don't want to be eating anything like super sticky and take that temporary crown off. You have to be super careful with that. Most of the time you're going to eat with the other side, so you're not messing with that temporary crown. And then in 1 or 2 weeks, you're gonna come back. That tooth that's had the root canal done, it's looking good, everything's healthy, infection has worked its way out, everything's looking good, and then you're gonna get that crown put on, and that crown is gonna fit like a glove. It is gonna be amazing. Hopefully it's gonna look really good, look super natural, and it's gonna fit great, and it's gonna seal off that tooth. So you're saying, Dr. Nate, all this stuff's too expensive. I just wanna get the root canal. Screw the crown, I don't really want the crown. I don't have money for that. And this is what I say to that. That is bad. That is really bad, because if you get this root canal and you do not put a crown on it, there's a very good chance your tooth is gonna fracture. And then that root canal was all for nothing. And you may know somebody, friend, family, somebody who got a root canal, just had a little patch-up job and then did nothing after. And then what happened? Boom, that tooth fractures. It may not happen that week. It may not happen in 2 weeks from now. It may not even happen a couple of months from now, but it will eventually happen if it's on a back tooth, because those teeth take so much pressure. It is not meant to go without a crown. Once you're removing all that tooth structure, you can't just put filling material on there. It's not strong enough. You want a crown to go on that tooth to give that tooth the best chance of survival. But remember, just because you have a crown on that tooth, just because you have a root canal done on that tooth, it does not mean that tooth is good forever. You don't need a brush, you don't need a floss, you don't need to do anything. That is not true. This is not an implant. Implants are slightly different. Root canal crowns are definitely something you need to keep very, very clean. You need to brush, floss just like normally, because the bacteria can still seep underneath the crown, in between the tooth and the crown, those small layers, those microscopic layers, the bacteria can still get through there and then cause another infection. So just because you have a root canal, you have that crown, everything's looking healthy, you feel great, don't think that all of a sudden you're good. You gotta still practice great oral health. Those crowns, those root canals may last 10, 15 years, maybe more, but eventually you're likely gonna need them replaced in the future. Maybe not, maybe you're gonna last 30, 40 years or whoever knows. But you have to keep very, very good care of it. So you're saying, Dr. Nate, I don't want to get this root canal and crown. It's like, $1,500, $2,000. It's going to be super expensive. Should I really get it? And I tell you, yes. I think root canals, crowns are super vital, because nothing is as good as your natural teeth. Nothing is as good as your natural teeth. Make sure if you've talked to somebody who has a denture, partial denture, you will know. They will tell you, keep your teeth as long as possible, because nothing is good as natural teeth. Implants, not as good as natural teeth. Dentures, not as good good as natural teeth. Partial dentures, not as good as natural teeth. So you want to keep them as long as possible. If what, you're just saying, oh, whatever, Dr. Nate, I'm just gonna take out that tooth and that's it, I'm good. You know that's not true because I have another video that explains how bad that is. If you just take out a tooth and let everything else kind of do its thing, the other teeth are gonna go into that area, the top tooth is gonna go down, and you are gonna have a ton of issues. So that, I don't know, $1,500, $2,000, whatever it's gonna be, price range you have to pay for that root canal and crown is gonna pale in comparison to what you're gonna have to pay for it later. Because if you take out that tooth, these other two teeth are gonna come in like this, and the other tooth is gonna come like that, and then guess what you need now? You come see me, because you're gonna need braces or Invisalign to straighten those teeth, uproot that other tooth, and then do something in that area so that, you know, $1,500 or whatever expense it's gonna cost for that root canal crown is gonna be way more. You know, it's gonna be way, way more. You know, braces treatment is like anywhere from $3,000 to $5,000 or $6,000. That's just for braces. And you're gonna have to get an implant. That's gonna be like another $2,000. So it is worth it. Don't just take out that tooth just because you think, hey, I don't want to spend the money now. It is gonna be so much more expensive later. All right, so let's get into a little more precise. How much is a root canal gonna cost you? It varies a ton. If you see a specialist, it can cost $1,500, $2,000 just for the root canal. If you see a general dentist, it's probably gonna be anywhere from like $600 to $1,200. Totally depends on the area, your insurance, what dentist you go to, where you live, lots of variables. If you want more precise pricing, you can go on our website. We give pretty precise pricing for our patients, so there's no kind of hidden costs, so you can see the exact pricing. You can also contact your insurance because they will give you exact pricing. If your dentist is in network with that insurance, you'll know exactly how much what procedure costs because they are in network with your specific insurance carrier, so they can tell you exactly how much something's gonna cost. There you guys go. That is everything you can possibly want to know about root canals, the treatment, how much it's going to cost, why you should get it, if it's going to be painful, the different procedures, everything you want to know about root canals. If you want to have, or if you want to know more information, check out our blog. I'll leave it below, the link somewhere below. And as you know, I'm trying to put out blogs. And as you know, I'm trying to put out videos every single week, and I'm trying to answer all your questions. So comment below, subscribe below. If you have a great topic, let me know. I will try my best to answer it, maybe in a video like this. All right, guys, I will see you in the next video.